Hello, my name is Janika Kõrv and I'm the Program Director of Medicine in English at the University of Tartu. The University of Tartu is in Estonia the only university where medicine is taught. So almost 99% of Estonian doctors have graduated from there. A little bit about the program details. This is a special program different from others because this is integrated bachelor's and master's studies program. The duration of the program is 6 years, and finally after graduation you will receive the degree in medicine, MD, medical doctor. In the curricula there are 360 ECTs, where one ECT means 26 working hours, and it contains 13 hours classroom teaching and 13 hours independent and private study. The study form is full-time regular studies, and there is a tuition fee per academic year, no scholarships or tuition waivers. The admission numbers are updated every year. The language of the program is English. However, knowledge of Estonian language is required to communicate with local patients at the hospital. The basic studies are carried out in a system of courses in a predetermined order. This means that the student cannot progress to the next year without passing the exams from the previous year. Students are divided into smaller groups as it is more effective. Many courses, especially in the clinical part of the studies, are conducted in a hands-on manner and mostly with patients. Program consists mostly of compulsory subjects. It's 276 ECTs during the first 5 years, and on the 6th year you will have clinical practice, 55 ECTs. There are also elective and optional subjects in the curriculum, and elective courses can be selected from the list of the courses of the medical faculty, but optional courses can be taken from any faculty of the university. And there is also Estonian language during the first 3 years. The module provides international students with an opportunity to learn the language, receiving the level B1-2 and the terminology used in the professional communication. And finally, you will have final examination. There are 2 parts of courses in the curriculum. First, preclinical courses are during the first 3 years, and the students study in the modern academic buildings of the university, Biomedicum and Chemicum. They are located in the same campus, only 5 minutes from Tartu University Hospital. The second part, the clinical courses, are held from the spring semester of the 3rd year until the end of the 5th year, and they take place at the University Hospital. There is a simulation center, and students also visit real patients during practical lessons. So it means that this is really hands-on. In the 6th year, the students need to complete clinical practice, during which the students spend a whole year in different healthcare institutions in Estonia or anywhere abroad. The clinical practice consists of 5 parts: surgery, internal medicine, emergency medicine, family medicine, and elective practice. Finally, students must pass the final examination. After graduation, students will become general practitioners, GP, which is in Estonian language üldarst. Young doctors can continue their education in a residency program in Estonia or abroad. The residency training of medical specialists is currently performed according to more than 40 different programs. In Estonia, the duration of residency program is 4 to 5 years according to specialty. Of course, this is in Estonian language only. Altogether, more than 600 residents are in training at the faculty. Other benefits of the program: knowledge of Estonian language. After 6 years of the students can speak Estonian language. You will receive working permit or permanent living permit if you are a foreign resident. After graduation, one received a document which certify the registration in the Estonian Health Board as physician. And also there are extracurricular activities. Finnish students can join TASLO, which is a local organization uniting Finnish medical students, or Estonian Medical Students Association, EAYS. This is Estonian Medical Student Association. Of course, some Estonian language is needed to understand. And finally, to conclude the overview of the program in medicine, will it be easy? No. Worth it? Absolutely. Thank you.